Welcome back to our continuous coverage on the COVID situation across the country. Now, before we went into the break, we got you updates from Maharashtra, Delhi, Karnataka and Tamil Nadu, which have all seen a spike in the number of cases. In fact, all these state governments have been asking the centre to expand the scope of the vaccination. We'll speak to a few experts a short while from now to try and understand the feasibility of that and the latest trends in these numbers that they're seeing. But before that, I also want to talk about Punjab, a state that is seeing a serious problem. It is the only state to report a death rate higher than the first wave. The death rate, which was 1.45% last year, has climbed to 3.2% now, with the state reporting over 35 deaths in the last 2 days itself. Keeping the situation in mind, Punjab Chief Minister Amrinder Singh has extended night curfew in 9 worst-hit districts and has warned of stricter restriction in the coming days. The state, meanwhile, has urged the centre to provide the vaccines for younger people in the worst-hit districts as well. Well, Dr. Tanmay Mahapatra joins us to understand this latest trends coming in, the numbers. Dr. Mahapatra, thank you so much for speaking to Mirror Now. I appreciate you taking time out. What do you analyze, as per your experience and your expertise, what is the trend that you're seeing in these numbers, and what is the cause for this sudden spike in the cases over these past couple of months?
So definitely it's a trying time. We have to be sure that we are not dealing with naivety regarding dealing with a second wave potentially. There are several mutations which this virus has gone through. Also, there are different variants and strains we have actually heard about. Now, when we are seeing an upsurge of cases coming in different places, and it's actually following the similar trend where those initial cases were seen, like Maharashtra and other states where we had seen the faster picking up. There are definitely reasons for considering that this is actually a second wave that India is been through. And there are also worries because every time it has been seen that in this kind of second wave or something, if it is a second wave or if it is a re-emergence of some latent scenario, there is always a chance of the second wave becoming more serious. Our previous experience during Spanish flu and other things were actually similarly like that. So there is always a spot of bother and concern, and that's why it's very important. Number one, we have to be continuing the kind of personal safety measures that we needed to continue. Somehow there was a perception during the time when actually corona outbreak in India numbers started to go down. There was a feeling that, okay, corona is over. I have seen that people calling 2020 as corona year, as if the corona is gone. So that kind of reluctance may also be a facilitator of this kind of upsurge and re-emergence. So it is very important that we stop doing those kind of things, and as a system, government and the health system and all the organizing authorities need to ensure that the community awareness is there to ensure that we are not making ourselves off guard. And then there is definitely requirement of living with necessities, not just continuing in the normal life as if there was no corona ever. The ultimate menace is not yet over, and vaccinations going on. Vaccinations are ultimately the final solution for this kind of pandemics. But yet we are not very sure about what period of time, what number of dosage, and how many types of times of vaccinations are required. So it's actually definitely vaccine rollout needs to be done properly and as much as possible, but we still have to continue with testing and personal safety measures.
Well, Dr. Mahapatra, thanks for speaking to Mirror Now. I do appreciate you joining us, and an important message there that let's not forget we're still in the middle of a pandemic. COVID is not yet over and we can't afford to let down our guard.